amnesia, where he just forgets where his other alternate personality has gone to. And I think that there's this, I was reading about 2 days about how sometimes they have like a type of dissociation where they can look at themselves from like a third person point of view while their body is doing something else. So I think I've seen that in a few scenes where like Tyler is doing something and she hears it, but that he's actually doing something else in his own mind. And
the camera shots.
Yeah.
In the novel, it's the same that he realizes that there's some sort of
I think what you uncovered is a major teaching point with regard to a group of disorders called the dissociative disorders. And there's a major teaching point to be made here, and one that can absolutely appear on a standardized exam, right, including the national board exam. All right? So the situation in which you described as the character seeing himself or viewing himself as a third person is called depersonalization, right? That's the condition that you're describing. The out-of-body experience is an easy example of depersonalization. And with that, there's a major clinical pearl. And I think it may actually resonate with you right now, and that is, if you have ever experienced one of those episodes, you are not mentally ill. So there's the reassurance. However, if they are recurrent and they are clinically significant, that is, if they impair your functioning, then you are potentially struggling with a mental illness. And if that is the case, the mental illness that is likely to be the most likely diagnosis would be what? Anybody have a guess? It's called depersonalization, derealization disorder. So that condition, that actual disorder, is defined by recurrent and clinically significant episodes of depersonalization and or derealization. And where depersonalization that you described, for example, that out-of-body experience, focuses on the self, not feeling you're quite who you're supposed to be or who you are, derealization focuses on your immediate environment, that it has some unreal quality. The easy example there is deja vu. Again, if you've had deja vu before, you're not mentally ill. But if you've had recurrent deja vu that begins to impair your functioning, that's different. In neither case, the single best diagnosis is depersonalization, derealization disorder. If, like every other mental disorder, with the exception of delirium, what we're describing is not due to the effects of a substance or an underlying medical condition. Right? If during these episodes the EEG shows that you're seizing, then the single best diagnosis then is epilepsy, okay? Not depersonalization, derealization disorder. So, and that goes for every mental disorder. We always have to rule out what is often referred to as an organic etiology, and here organic always represents either or. Medical conditions and substances. So I guess the next question I have before we continue with your observation is whether or not there appears to be substances in Fight Club that might actually explain the behavior that we've observed. And the way I would go through this, and we're going to go through the same type of algorithm for medical conditions as well. So the first question is, in observing this film, in observing Fight Club as a fictional case, is there anything that is discrete and written into the script that the character uses substances? Is it obvious?
He makes soap, and I think that he making soap is exposed to a lot of different chemicals that he can think of as some kind of substance use that's just happening while he's working on the hobby.
So the observation is that toxin exposure is specifically and discreetly written into the script, and therefore a substance-induced we'll call it dissociative disorder, should be high in our differential. I agree. Anything else that is specifically in the script suggesting that substance use plays a central role in behavior. Smoke cigarettes. Right? What you also should know is that while nicotine use disorder or tobacco use disorder is real, and it is considered to be a mental disorder, tobacco cannot induce a mental disorder. There's no such thing as tobacco-induced dissociative disorder, because there's no such thing as tobacco-induced any mental disorder, whether we call it psychosis, depressive, manic anxiety, or other. Right? So probably not playing a central role in what you're observing. Any other?
Also, so many of the scenes are taking place in a bar, or he's holding like a handle of vodka, or he's drinking, so he could, hallucinations with some kind of alcohol withdrawal.
And there is alcohol discreetly written into the script. And yes, alcohol can induce what we're describing. It can induce it both during its intoxication, as well as its withdrawal phase, as well as in a separate category of other. Right? Other here, focusing on the Wernicke-Korsakoff syndrome. Now, he's a little young. Usually it's with chronic use, and I think Brad Pitt's character, even Edward Norton's character, is probably young. However, we should consider it. If your answer to the question, the original question, was no, there's nothing in this script that would allow us to say that substance use plays a central role, the question then is, despite it not being in this script, should we as clinicians still continue to consider it? And the answer should always be yes. And to what extent will depend upon you as a clinician. All right, that's the idea of maintaining a high clinical index of suspicion, despite the fact that our patients tell us no. Cage, see, cut down, no. Anger, annoyed, no. Any guilt, no. Eye opener, no. What do you do then? Depends. Right? Some, like yours truly, will still go through what is referred to as a structured clinical interview for alcohol use disorder, primarily because that's the reason for the consult. Some won't, right? And what you do will ultimately be up to you. We're going to address an underlying medical condition the same way. If we look at this through either Edward Norton versus Brad Pitt's perspective, is there anything that is discreetly written in this script that shows an underlying medical condition or reveals an underlying medical condition?
Yeah.
Potential, but insomnia, sleep-wake disorders, published in the DSM, so we're going to call that a mental illness, but I see your point. That's one like the neurocognitive disorders that is not a true psychiatric condition, right? That's certainly something that we would consider psychosomatic, having two significant components.
Could it have to do with like electrolyte symptoms? Because like he's not eating any large scenes, and also he gets more and more progressively haggard. He doesn't have like the house, the Lapid's house doesn't have any kind of like things that we would expect in a house, for example, a laundry machine or anything. He's like washing his clothes with like a little toothbrush, probably not taking care of himself. Right. So that's a little bit of a softer rule out, if you will. While I don't think it's discreetly written in the script per se, it does definitely focus on the next follow-up question, is that despite it not being discreetly written in the script that he has pancreatic cancer or choice B, C, or D, should we consider it nonetheless? And the answer would be yes, because of what you observed, right? So I think we still need to keep it in a differential diagnosis. Now, in the absence of even that observation, the question as to whether or not, in the absence of any information, discrete or otherwise, whether you put it in your differential, really should come down to two risk factors, and that is sex and age. On your shelf exam, if it is not in your clinical vignette that there is an underlying medical condition or any laboratory results that are abnormal, if the patient is young and female, you can assume health. If they are older and male, you cannot. Same exact vignette, but you remove 20-year-old female for a 55-year-old male, and your answer is going to be completely different.
And that applies the same in film. Now, the main character in this film is a hybrid. They're somewhere in the middle, right? They're on the young side and they're male. So they have one risk factor and one protective factor. So what do you do there? It depends on the clinician. If you're conservative, you're going to treat them like an older male. And if you're not, you're going to treat them like a younger female. And that'll be up to you. Fortunate, in a way, for us, to further clarify, there is some stuff in this script that you observed that I think we should push this young male over to that high risk category. Right, so we'll leave it in our differential. So as we're considering this, an organic etiology playing a central role, we should look now to another form of dissociation. You actually said the diagnosis aloud a few minutes ago, dissociative amnesia. Okay, so this is amnesia. This is forgetfulness. Specifically, amnesia that cannot be attributed to quote-unquote normal forgetfulness, for which the underlying etiology is stressful in nature. Okay, so again, we've already applied the idea of a medical condition that would of course include head trauma. And if we had discovered that, well, that certainly would inform what might be the etiology of the amnesia. Otherwise, dissociative amnesia. The trick here, especially for exam-taking purposes, is to remind yourself that if the patient presents with all of the above, the single best answer is dissociative amnesia. Because dissociative amnesia, in its definition, includes episodes of depersonalization and or derealization. It's not required for the diagnosis, but it is a characteristic of dissociative amnesia. You will not give your patient both diagnoses because the subjective sense that they or their surroundings are unreal in some way may be attributed to the dissociative amnesia and does not require a secondary diagnosis. So the big reveal, of course, is that this appears all to be due to dissociative identity disorder, or DID, which is when an individual, due to past trauma, not only dissociates, but creates another state of consciousness to experience the trauma so as to protect themselves from experiencing it, referred to as an alter. And as you would probably guess in terms of what I'm getting at, individuals who suffer from DID will have dissociative amnesia when they switch to the other alter. And the answer is yes, they will also experience periods of depersonalization as well as derealization. That is, all of the above will be attributed to the primary disorder called DID. No reason to diagnose the character in Fight Club as having all three conditions. And that is likely to come up on your shelf exam. A vignette that contains episodes of depersonalization and or derealization, as well as amnesia, as well as an altered state of consciousness. Single best answer is DID. Any other thoughts about this main character? It's talked about potential underlying medical conditions explaining this, potential role of substances, and if we as clinicians deem that they're not playing a central role with regard to the etiology or manifestation of the illness, then DID does appear to be the single best answer.
I was also thinking, in my studying, I came across that in dissociative amnesia and DID, a lot of times when the patient realizes who they are and those memories come back, they're at a greater risk for suicide. And I thought with the last scene where he, shoots himself in the head essentially to get rid of the thyroid burden that he was seeing, kind of reflects that that problem that you may see in patients that are suffering from DID.
So that's a great observation, and I think there's plenty to teach off of that. All right? Again, the idea here would be with increased self-awareness, what is often referred to in psychotherapy as consciousness raising, there is increased risk for suicide. we see a very similar phenomenon, increased risk for suicide, with improvement in one's schizophrenia. Right? The highest risk for suicide with people struggling with schizophrenia is within the first 6 months of hospital discharge, when they're actually getting better. Insight might be improved, and there might be some role of that in a subsequent suicide attempt. And we see that paralleled here. And that brings up the idea that dissociation and psychosis are very, very related. There's a high incidence of psychotic features in the dissociative disorders and vice versa. There is a significant incidence of dissociative features in individuals diagnosed with schizophrenia. So the neurobiology has some overlap. And that overlap may also explain the observation that when the condition improves, whether we call the condition dissociative or psychotic in nature, in either case, there is an increased risk for suicide. And that's exactly what happens here. It even says, I'm going through a hard time or a time in my life when I'm struggling with some things, to paraphrase. It's insight. What else?
I think also his childhood trauma really puts him at risk for developing his dissociative identity disorder. I think at one point, I forget the name of the female character, but he was detailing his relationship functioning as like the intermediary between him and Tyler. And he related that to his relationship with his parents and their challenging relationship. And that definitely puts him at risk, not only for DID, but many other conditions as well.
Yep. So, it's interesting that you picked up on that scene, because there is a conspiracy theory that the primary case is actually Tyler Durden, and Edward Norton's character, the unnamed character, is the alter. But what you had just pointed at actually is contrary to that. That is, if the memories of the father, the memories that are repressed, are those of Tyler Durden, then he would be the alter, which I think is more consistent with what David Fincher implies. I think that was probably his intent. But the conspiracy theory switches things. And if the primary case is that of Tyler Durden, it would be inconsistent that character would have those memories. We would expect Edward Norton's character, therefore, to have those memories. But again, it is consistent with what we think. As an alter, he would have those memories that are repressed, because whatever his father was doing, whether it's abuse or neglect, both, it would have been Tyler Durden that would have been the alter, that therefore would have had that experience, sparing it for the primary case, the unnamed character, and therefore would have those memories. It's the whole idea behind DID.
There's also some element like antisocial personalities going on there. I mean, it starts with him having these fights and ends with him creating a national terrorist organization.
Yep.
It seems to be a sort of stable involved throughout the movie.
I think the major theme of Fight Club is a blatant disregard for and violation of others' rights. You can print that verbatim right out of the DSM as the cardinal trait of the antisocial personality disorder. And when you look at the DSM criteria, then they serve as straightforward examples of that cardinal trait, and therefore that theme of the movie. The question then comes up as to whether or not those behaviors are manifest within the context of DID, or do you see them outside of DID? Because you'd be careful not to attribute those behaviors to a secondary personality disorder called antisocial personality if treating the DID would improve those symptoms. So that's where it becomes tricky. Right? When we think of personality disorders, we must always be careful with regard to the diagnosis during acute illness. When people are ill, they simply behave differently. And that goes for illnesses attributed to a physical cause, a mental disorder, as well as the use of a substance. In all three cases, you address the primary condition and you observe the behavior. And if the behavior changes, then you could attribute it to the primary condition. On the other hand, if it persists, then you may have a personality disorder that was co-occurring. We really don't know the answer to that until we see the sequel to Fight Club. There's no sequel to Fight Club.
Talking about like multiple disorders that could be going on, could he also have schizophrenia? I know that you said that they were inexplicably linked, but is there any chance that he has both big diagnoses?
There's a chance. People with schizophrenia have a significant incidence of dissociation, and certainly in its most severe form, that could take the form of DID. Those can co-occur. It would be extremely rare. If we think that the main character in Fight Club is afflicted with schizophrenia, I think the clinician would first look to see if they can improve those symptoms and see if the dissociative symptoms clear. And again, similar to addressing a personality disorder that may be co-occurring, if they don't clear, then you have something secondary going on, and that could be DID. Right? So even though it's rare, it can happen, but it would be extremely rare. I mean, except for the dissociative state, the amnesia, and episodes of depersonalization and derealization, are there other psychotic symptoms that you're concerned would not be explained by a dissociative disorder? There's some sense of paranoia. And if the answer is yes, we still have to answer that question. Is it because the literature tells us that there are psychotic features associated with these dissociative conditions, or might there be a co-occurring disorder within that psychotic disorder chapter? And again, I don't think there's any discrete answer here.
When we say that there's a risk of suicide for somebody with psychosis or schizophrenia because of the realization, is that paranoia that he sort of displays because he's having some realization of that secondary personality, or is it a co-occurring like, is it a symptom because he's realizing that something is going on, or is it something added on top?
I think, and when in doubt, and again, there's a lot of doubt when it comes to human behavior, because very infrequently do people actually behave in concordance with a textbook, even the DSM. Right? These are artificial categories. But when in doubt, I think it's always safest to practice conservatively and think that it's one disorder explaining everything until proven otherwise. So conservative approach, but you've got to be flexible too, because when you're presented with clinical information that is inconsistent with a single diagnosis, the clinician should expand the differential. And in this case, it would include probably a coexisting psychotic disorder. Let's talk about a sleep disorder, because that might be co-occurring. Again, we're going to approach this the same way. But let's say we're at a point that we've clinically done our due diligence and think that there is a coexisting sleep disorder. What's your differential here? How do you approach this? By the way, he presented to a hospital with a chief complaint of insomnia, so we've got to address that, right?
I kind of addressed that this morning with the scientist episode. We were talking about Kramer's sleep. And I guess the conservative management in that is really addressing like how, where, when the sleeping is, because just the environment can affect that sleep. I think when we were talking about this morning, it really was you have to be as conservative as possible to address that first before you kind of move on.
Mm-hmm. And always keep in the back of your mind as a clinician that while I totally agree with you, and it is good to not only approach this biopsychosocially, but initially psychosocially, right? We always talk about the judicious use of medication, meaning that after psychosocial interventions have been unsuccessful. But also, again, we have to remain empathetic too. The patient is likely presenting to us when it is clinically significant. So they've probably been struggling with this for months before they actually see us. So when we provide feedback that there's nothing to do right now, we're going to proceed cautiously, they may not actually be impressed, right? They may be looking, I mean, they're at a point where in their mind, they're already looking for a medication to be prescribed. Of course, then it's totally appropriate to review what the patient has tried, albeit on their own. And hopefully it is consistent with evidence-based measures of sleep hygiene. It is interesting in this movie that the narrator's insomnia looks to predate the dissociation, right? I mean, he's got problems, and I even think he's seen a physician prior to his first quote unquote seeing Tyler Durden or meeting Tyler Durden, right?
I also think that his work and his constant traveling and stuff brings up the question: is it a primary sleep disorder or is it just jet lag? And if that's the case, do we consider jet lag a disorder?
Absolutely do. It's called a circadian rhythm disorder. We actually have to create a fancy name. We can't call it jet lag. But there are, I think, 4, if not 5, different types of circadian rhythm disorders, and jet lag type is one. Right? Again, I don't think it actually has that easy name, but what you're discussing is in fact one of those 5. Right?
When I was reading online, I was just looking into insomnia because that was one of his first symptoms. DID and insomnia is a symptom of DID, what I was reading, and also it can exacerbate the dissociative symptoms.
And again, we see that his insomnia has gotten to a point, again, my example, that it reached the limit before he went to see that physician. He was looking for a drug. He was asking for the benzo. So it is very likely that he's been struggling with this for weeks to months, and that the physician is brought into the equation late in its course, or later in its course. And if that is the case, then the insomnia is probably severe enough to act as a stressor with regard to precipitating another illness, perhaps DID. Right? Remember, generally speaking, for all human behavior, and especially, at least as far as we're concerned, for abnormal human behavior, we have to think not only biopsychosocially, but with regard to what is predisposing, precipitating, and perpetuating the behavior. So every time you see a patient, whether it's on a CL service or whether it's taking notes watching a movie, and it's okay to nerd out and take notes watching a movie, build a 3x3 rubric. Across the x-axis, bio, psychosocial, creating 3 columns, and the y-axis, creating 3 rows, predisposing, precipitating, and perpetuating. After you take notes, whether it's at bedside or whether it's watching a movie, try to begin to fit the information that you actually recorded into one of those 9 boxes. Because the extent that you can, at the end of this exercise, you have a nice visual with regard to why the person did what they did. Another way of saying that, what the etiology is of the dissociation or depression or insomnia or anxiety. What looks to be a precipitant other than the insomnia? So again, in that 9-box rubric, the insomnia looks to have been, at least the severity of which, a precipitant, and we'll probably call it bio. Again, is it bio or is it quote unquote psycho? My prejudice is that insomnia and sleep pathology is biological. So I'm going to say it's in the bio column, and probably the precipitant row. Anything else?
Do you include that though, the psycho, the anxiety related to not sleeping? Because it's a kind of perpetuating effect if you have a biological derangement causing insomnia and then the precipitating anxiety of not being able to sleep every single night.
Yeah, and it depends on how you want to approach that. If you want to just flip the insomnia over to the quote-unquote psycho column, perfectly fine. I wouldn't double dip. So, and you wouldn't be wrong if you did. I just turf it into the bio column. But certainly, every mental disorder is psychosomatic. You cannot possibly name a single illness ever described that doesn't have both quote-unquote psycho components and somatic components. So in that way, they're all psychosomatic. And to the extent that you believe the scale tips one way versus the other is up to you in terms of what column you place it in. What else is going on the scene or the scenes prior of his first meeting Tyler?
He's investigating some traumatic crashes in cars, these things that could be could trigger stress or these sources of trauma for him.
Yeah, I would put that in the psychological column, right? So job related. Certainly when he first meets Tyler, he's on an airplane, so that could also be part of the trigger. So it's really vehicle crashes, whether it's airplane, whether it's auto. So I would lump them together in terms of the psychological as a precipitant. Anything else?
Is that the time that he's fighting with, what's her name, with the three crews?
You have to remind me, I didn't watch it last night. When is he fighting with Marla?
Marlon. They're like splitting up the groups. I think that's beforehand because he disappears for a while and then he comes back and she's cheated and gone to his mom.
So there's a new interpersonal relationship last night. Potential precipitant. Again, if a person comes into your office saying I have difficulty sleeping, and during the course of a psychiatric evaluation, an H&T, they tell you there's a new person in their life, the psychiatrist cannot possibly ignore that.
I think, yeah, even explicitly said that like she intruded into his anonymous groups, and then she's directly in his home, and then she was with his friend. So yeah, definitely precipitant just as an outside factor.
I agree.
Is it possible that, like, you know how, like, there's super ego is, I was wondering if Tyler can be, like, his kid. Like, because, one example of that is, like, he has this, like, really nice apartment, and then he, like, collects furniture, right, that looks, like, really great and everything. And then he, like, collects all this real furniture, and then he, like, but then, he burns it down. And so I'm just wondering if, like, that was, like a conflict between his super ego and his kid.
I think that's exactly what's going on here. Let's just go down this tangent a little bit with regard to some psychodynamic theory of what's behind this character's behavior. So, I mean, there are two people we need to consider here. One you mentioned is Sigmund Freud, and another would be his contemporary, Carl Jung. So, from a Freudian perspective, yes. I think that Edward Norton's character, the narrator, is a superego, right? It's a facade that this character portrays to the world. It's the face that everybody sees, with the IKEA furniture, with the job. What lies underneath is Tyler Durden, and that would be the id. We are all id up until about the age of 2. And then from that point, we begin to have society's norms infused so as to create a second, albeit contrary component of who we are, called the superego. And what we want to do, age 2, is crap in our pants. And what now we're being told we must do, go into this room, sit on this porcelain thing and do it this way, are going to be equal and opposite. So at that point in time where that reality principle is infused, we are in conflict. Hence the third and final part of our personality, our subconscious, called the ego, which is going to moderate the devil and the angel, so as to reduce the anxiety caused by the friction between those two. Maybe that's Marla's role, because clearly Tyler Durden is the id. He is the primal component of who this character is, and he's been repressed. So in a way, one way to kind of itself resolve the issue of who the primary character is, it is Tyler Durden. Although we come into the situation as viewers, as observers, at a point in this person's life where that id character has already been repressed, like all of us. So he is the primary character, that is, he's the first to have existed, yet the primary character in the movie Fight Club is Edward Norton's character, that superego, who has already taken over. There's that conflict. And certainly these two characters are definitely in conflict. Right? Fight Club. Maybe Marla is the moderator, the ego, the one who will resolve this anxiety. So yeah, I could definitely see a Freudian perspective in this film. Could also see a Jungian perspective. And to some extent, there's overlap here, right? Both are psychodynamic theorists. For purposes of Jung's theory, we are looking at the id pretty much renamed the shadow. And Jungian psychotherapists would stomp up and down right now and have a fit that I said that. But for our purposes and for your exam taking purposes, let's just relabel the Freudian id as the Jungian shadow. We'll also rename the Freudian ego, perhaps Marla's character, as the self. And Carl Jung really doesn't have an equivalent for the superego. So we're gonna have to flip the script a little bit to understand this through a Jungian perspective. Does anybody know, in lieu of a superego, what Jungian theory did introduce with regard to understanding personality development? What's the component of the Jungian subconscious or collective unconscious that I haven't named? The self, the shadow, and the animus/anima. Jung's focus was that we all have female and male components of who we are. The animus, the male side, which is dominant in females. And the animus, the animus is in females, the anima, the female side is dominant in males. That is, it's our subconscious. So in a way, we can look at these two characters as a battle between the animus and the anima. I mean, who's the hypersexual male? The animus in this movie, right? Do you recall the exact scene in which they met?
Sitting on the planet.
Right? And give me the visual. For somebody who maybe didn't watch the movie or doesn't recall that scene, give me the visual. Paint the picture of what actually is going on that plane.
So they're discussing like the emergency exit, and Tyler Durden was just commenting on like how much responsibility it was.
Who's sitting where?
Tyler's closer to the exit.
Tyler's got the row seat? And
yeah, he's closer to the exit of the exit emergency room.
Right, okay, so actually he's at the window seat, right? And how does the scene end?
They were discussing like the positive nature or like the positive descriptions of the drawings on like how to brace for impact.
Okay.
And how that was kind of contradictory to what you would expect.
And they claimed you're getting high on oxygen.
Yeah.
Mm-hmm.
Oxygen.
Mm-hmm. And how does that end? How does that conversation literally end? Well, that's outside of the airplane. How does the airplane scene end?
Tyler Durden stands up, takes his briefcase, and walks to the front of the airplane.
Right? And as he's walking past Edward Norton, who is in the aisle seat, he says something.
That is something about you want front or back.
Right. Right. So he's actually going to assign the gender role here. What does he do? Does he give him the front or the back? Gives him the back, right? I think he says crotch or crack, and he assigns quote unquote crack to Edward Norton. He is assigned crotch, and you have this animus and anima battle the rest of this movie. So this gets the Jungian theory. When is it that, and again, Jung deviates from Freud with regard to personality development across the life cycle. Freud believed our personality was crystallized at a young age. Okay. Jung really departs from that and talks about personality development over the life cycle. There are 7 stages to this life cycle. Anybody know what stage the individual has the anima versus animus battle? Adolescence. adolescence. The specific stage, if you recall back into your Psychology 101 course, is, I believe, identity versus role confusion. And Fight Club is about role confusion. That's the fight between the animus and the anima. The animus, Tyler Durden, and the anima, the unnamed narrator. So Fight Club is about Jungian psychology focused on adolescence. Why do we think this character is regressing back to a time of adolescence? Well, we get back to that 3x3 rubric you built. There were stressors that results in a regression here. So in one way, from I think a clinical perspective, you can say that the stressors, the precipitants, result in an exacerbation of DID, but the analyst, the psychoanalyst would say that those very same stressors result in regression back to an adolescent stage of development, where the animus is battling the anima. He's trying to figure this out, i.e. role confusion. So whatever the trauma was likely occurred when he was an adolescent. And whether you want to figure that out to be the trauma that results in DID, or the trauma that, just using different vocabulary, results in his regression back to that Ericksonian stage, depends on what type of doctor you are. That's another view to your point of Simon. I agree. Well thought out. One thought I have with regard to a conspiracy theory goes back, way back to when we began this discussion about the role of substances. It's a hidden Easter egg that there is coffee in every single scene in Fight Club. And the role of caffeine may be significant here. And certainly, while we wouldn't expect caffeine to induce a dissociative disorder, caffeine can absolutely induce insomnia or a sleep disorder, which itself can act as a precipitant to his dissociation. So I think we have to figure that out as well. So yes, tobacco, probably not much of a role. Yes, alcohol, suspect a role. Now caffeine. And we can't rule out what in the DSM would be in a category labeled other, which would include toxin exposure, especially looking at where he lives.
This is totally out on a limit.
Go for it.
I was also thinking, like, at the beginning of the movie, one of the support groups he goes to is a tuberculosis support group. And I was like, maybe this is all like tuberculosis encephalitis or something.
Yeah, I looked at those groups as well.
Yeah.
I think it is further evidence to suggest that there might be an underlying medical condition. At least that general leap that the clinician has to consider, we might take because of these different groups. I then thought, if we're going to actually then go from general medical condition to begin to narrow our focus, might the groups that he chooses in divvying them up with Marla shed further light? So that's a consideration. And I don't know which ones I haven't written down. It's in a PowerPoint slide somewhere, so I don't have that readily available. If I find it, I'll post it on Instagram. Only you guys will know what the heck I'm talking about. Yeah, so that's definitely something I thought of as well. Now, there was one group, we probably don't have a lot of time. Let me stop here. In the afternoon, we could discuss this even a little bit more. But there's one group I wanted to add to that, because if you look at the different groups in totality, him plus Marla, and you add ALS, it's noteworthy for some reason. Okay, so I'll just leave it out there as a teaser. We'll leave it at that, and we'll stop here.